Welcome to Clyde Health Medically Speaking and our special series on the fight against the coronavirus. As you can see, we have modified our format to practice safe social distancing while providing timely and factual updates from the Clyde Health team during this public health crisis. We as a healthcare organization believe it's important for the Western New York community to hear from our medical experts who are leading the charge in our facilities and with our workforce of over 10,000 strong. I'm Mike Hughes, and this is Medically Speaking. Welcome, Carol Horton. Thanks for joining us today.
Nice to see you.
So tell us a little bit about the Clyde Health Foundation and how you guys are mobilizing in this current public health crisis here.
Yeah, so Mike, what we've done in addition to all of our regular efforts is we have established a separate fund strictly dedicated to COVID relief. So we need folks to go to clydehealth.org/COVID response fund. So that's COVID response fund. And there's a very simple mechanism whereby they can make a donation, and those donations will directly go to supplies that our healthcare workers need to keep everybody safe and healthy.
So normally the foundation has a lot of events and there's a lot of face-to-face with donors and board members and employees and all that. Tell us how this has changed a little bit in this current environment.
Yep, so we've had to pivot just like everyone else. So instead of being such a hands-on organization, we've obviously had to practice all of our social distancing too, to keep everyone safe. So we've gone from having so many of these in-person events where we're really getting together and celebrating everything that we do at Clyde Health and talking about the future. And instead, we're really working on this particular scenario right now with the crisis with the virus. And so we've had to work all remotely as well. You know, obviously lots of this kind of communication, lots of email, lots of text, and we're still trying to get all of our connections together to really help support what we need right now, and that is the response to this virus.
So from the foundation standpoint, tell us a little bit about the outpouring of support. You know, people who have reached into the organization, whether it's through the hospitals or the management or the foundation. What's the response been from Western New Yorkers?
It has been unbelievable, just like you would expect from Western New Yorkers. I mean, we're hearing from people from every sector, and really all walks of life. I mean, so far, the same day that we announced the COVID response fund, for instance, the Buffalo Building Trades stepped up with a $10,000 donation. Josh Allen has stepped up with a $10,000 donation. We have another private company that stepped up with $5,000. And then in between, we're getting people that are donating $5 here, $10 there. You know, basically $10 could buy a healthcare worker a meal. So it's been wonderful, all the way from celebrities and tycoons of industry to, you know, your next door neighbors and your parents, and everyone's really been stepping up.
So in terms of how long, you know, this may last or how long this may go on, do you guys see this as a campaign? And if so, you know, is this something that you see going through the remainder of the year?
Absolutely, for sure, through the end of the year, because no one really knows where this is going to lead, right? I mean, we have the predictions that we're going to be at the brunt of the curve pretty soon, and hopefully we're flattening the curve. But the bottom line is, at least for now, it's a day-to-day, week-to-week thing. So that's really how we have to treat our fundraising efforts too. We have to be reciprocal to what the need is. So we continue to plan to do that and continue to generate funds as much as we can to help the need.
Carol, tell us a little bit about the foundation and how it interfaces with the hospitals on a day-to-day business before this current public health crisis.
Right. So the foundations are really there to kind of help fill in the blanks. Obviously, you know, we have funds and we do have somewhat of a revenue model that helps us go on a regular basis, but there are always things, more programs that are needed to really make what we do special and to really touch the people of Western New York. So the foundation is there to really add a lot of the creature comforts to make things more palatable when people and families are going through really hard times. So we try to make things a little bit more comfortable for people, and also then provide services and even equipment that maybe other healthcare providers wouldn't have, which would be one of the things that makes Clyde Health so special.
So, in light of this current crisis, what are some of the things that you may be hearing about what the organization may be in need of? I don't think the community can really appreciate the devastation that's going to happen to the entire healthcare system, not just with Clyde Health, but with others in West New York and across the state, just because of the loss of surgical volume, the loss of traditional volume,
Mhm.
and then the supplies and all that are needed to be purchased. So, what are some of the things that you're hearing about?
So, of course, from the supply angle, what we're really hearing about is the PPE, the masks and the gowns and the gloves, and that those things are really needed in the short term to help keep our healthcare workers safe and obviously to stop the spread, which we hear so much about. But as the weeks and possibly months go on, we're also going to have to be supporting our healthcare workers. Maybe their spouse might be losing a job and they might not have the income that they normally would. So in order to support our healthcare workers, we're going to have to support the entire healthcare worker, not just at the time when they're in our hospitals. So I don't think anyone even really knows what that looks like yet, but we know that we need to be prepared, and we certainly know that the need is going to be very, very great, and something that we have to keep in the forefront as to how do we support those folks all the time.
So, as we wrap up here, one last plug. Tell us what that website and the fund is again.
Yep, so it's the clydehealth.org/COVID response fund. And there's also going to be a fundraiser coming up this Friday where the funds will go to that. And it's something that people can do to try to have, a little bit of fun in this time of crisis. So this Friday from 6 to 8, with our help of our friends from Giancarlo's, you can go to livecovathon.com. It's going to be a little free concert. There's going to be some live auction items and a little way to have a little levity, and all the funds will go to that clydehealth.org COVID response fund.
Well, Carol, thank you to you and your team on behalf of all the staff, the nurses, our physicians. We thank the foundation for jumping in and getting involved so quickly. Thanks for everything.
Thank you, Mike.